As you gear up getting ready to start your medical school application, one thing you need to ask yourself is if you want to pursue an MD degree or a DO degree. Not a lot of people really know what a DO degree is, what the differences are between the two, or even the truths behind some of the stigmas that are associated with DO schools. This video will help to clear everything up to give you all the information you'll need as you think about which path to take when you apply. First, let's go over some major overview things about both degrees. In this video, anytime you see blue text, it means that what you see is a similarity between the two programs, and red text means that there are differences. Anyways, the MD stands for medical doctor, while DO stands for doctor of osteopathy. Although they have different names, both will require you to complete the MCAT, go to medical school, complete a residency, and take board exams. Both degrees also allow you to choose any specialty you want, gives you the ability to diagnose and treat, and perform surgeries as well. The main difference between MDs and DOs are in the focus of their practices, but we will get into that a little later in this video. By and large, they are extremely similar degrees that offer the same opportunities. Looking at the curriculum you will face in an MD school versus a DO school shows very little difference. You will have preclinical science courses followed by a series of clerkship rotations no matter what degree you pursue. The only difference is in DO school, where you will need to complete osteopathic manipulative training. DOs tend to have higher focus on the musculoskeletal system and will therefore need to practice physical manipulation of the body as treatment. Also, DO schools tend to accept more non-traditional students into their incoming classes, or students that may not have been as competitive in the MD admissions. This is not a reflection at all of the quality of incoming students. It has more to do with how many programs are currently available and what the practice represents. When you take your board exams as an MD, you will take the USMLE STEP exams. As a DO, you will need to take the COMLEX exams. Now, a lot of DO students choose to take both COMLEX and STEP exams because it makes them a lot more competitive applicants into residency programs. But at that point, you are obviously having to take more board exams. So while yes, it is optimal to take STEP exams as a DO student, if you are looking to get into a competitive field, you might want to take them. And why exactly would DO students need to be more competitive when they apply to residencies? Well, that's because as of 2020, MDs and DOs apply to the same residency programs through the same platform. That means MDs and DOs will most likely be doing residency programs together. The match rate to programs overall is similar between the two concentrations, with both boasting an over 90% match success rate. However, the difference is in the specialties. MDs are more likely to pursue specialized medicine in more competitive fields like vascular surgery or neurosurgery, and the match rates reflect this. DOs, on the other hand, have a much smaller percentage of applicants that match into a competitive specialty, but that is because DOs are much more likely to go into primary care. In fact, more than half of all DOs go into either family medicine, internal medicine, or pediatrics. And that has a lot to do with the philosophy associated with being a doctor of osteopathic medicine, which we will get into next. But before that, what you should take away from this slide is thinking about whether you want to specialize in something or do primary care. Now, chances are you may not know at this stage, and you can get into any specialty through either program. It's just the difference in focus that gives one an edge on specialties and the other an edge with primary care. And what are those philosophical differences I keep talking about? At its core, MD programs tend to focus more on targeted medicine, trying to solve a singular problem through research-backed trials and data-driven care. On the other hand, osteopathic medicine reflects more of a holistic approach to medicine. That means if you are an advocate of things like preventative care, nutrition, letting the body heal on its own, and physical therapy, you might like the training and skills you learn in a DO program much better. At the end of the day, picking between these two concentrations of medicine comes down to this one question: what philosophy of medicine do you wish to practice? MDs might not spend as much time with their patients and prescribe them a lot more medicine, while DOs might see fewer patients but really focus on their interpersonal relationships with the patient and try to help them on a holistic basis. Do the salaries between MDs and DOs differ at all? The answer is no, not at all. The biggest difference you see in salaries is between the different fields of medicine, not the degree you earn. In fact, when you look within the same specialty, the earnings of MDs and DOs are incredibly similar. There seems to be a myth going around that DOs don't make as much as MDs do, and that simply isn't true at all. Just as a quick review, when you are trying to think about what kind of doctor you want to be, think about what kind of practice you want to have, what you want to focus on as a doctor. Also, if you are a non-traditional student trying to get into a medical school, consider a DO program if you feel you aren't competitive enough to get into an MD school. Remember though that this doesn't undermine the rigor and difficulty of a DO school, they are just as challenging as traditional MD schools. If you think you already know that you might want to do primary care, maybe seriously consider going into a DO program. I actually think DO schools do a lot better of a job preparing you for a primary field because you spend a lot more time focusing on how to interact with patients. But if you think you want to be a super specialized surgeon, you are probably better off with an MD. Look, there seems to be a lot of stigmas associated with DOs, and the whole point of this video was to show you that they just aren't true. DOs get paid just as much, are just as qualified, and can do literally the exact same thing as MDs. The only difference is in the philosophy. Recently, there has been a trend of more people pursuing DO degrees, and for good reason. So don't let whatever you've heard from either your parents or people outside of medicine sway your opinions on DO schools. Understand the facts and come to your own decision on what would be best for you, since this is your path we are talking about here.